it's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and the topic today is about tonsils and adenoids and if they can grow back. You can Google search this yourself. The research is mixed. You can go to tonsils and adenoids surgery, scholar, grow back, it should bring it up. The research is definitely mixed, but the consensus that I've reached after talking to some ENTs and attending some lectures recently, most recently I went to the course by Dr. Simon Wong. He's a dentist, but he does a early interceptive course that heavily focuses on airway and ENTs and collaborating with ENTs. And the ENT that was lecturing, Dr. Narinder Singh, he definitely said 100% adenoids can grow back. He felt the rate was low, in the 10 to 15% if it was done properly, but it depends on how properly the initial surgery is done. But even if it's done properly, there's still a percentage. He said that it is lymphatic tissue and that it can grow back, just like anything else, especially with certain illnesses can cause it to grow back. So if you ever have a patient that you're screening for ortho and they are saying adamantly, well, we already had this surgery, you might need it again. But he also was very much in favor of working with your ENT and seeing if you should try the expansion first before jumping into the surgery. So I really liked that. And we do have some screening forms at Straightsmile Solutions that we gladly will give to any dentist who works with us, takes one of our courses, does an a la carte session, anything like that. Otherwise, our paperwork is for sale. But we have a sleep disordered breathing form. There's lots of those floating around up there. We have an ENT referral form, as well as I just use the Ferrist form, which is not my form. You can look it up. The Ferrist form, it's an OMT, a mile form, where they're basically going in and they're teaching you how to look at tonsils and Mallampati scores and stuff like that. Obviously, adenoids can't be seen clinically. You have to see it in the SAF or a CBCT. And he did point out that, remember that the size of the airway or the volume is difficult to assess because what it is depends on how floppy it is, right? Some people's are more elastic, some people's are more firm. So it's all these people who are saying that they're just growing an airway and look, now here's the volume. Well, that's vertical. It's going to be completely different. And the physiology of the airway can change when they lay down, and right now there's really no way to assess that when you lay down besides just doing an in-house or lab sleep test, and seeing how oxygenated the patient is and how many interruptions they have and their AHI and all that. So definitely you should definitely take a look at some of these courses. But yeah, the main point I wanted to get around to you guys is that at least adenoids can grow back and will grow back, and it's hard to predict. So just because your patient has had a surgery before doesn't mean that they don't necessarily need another one. So strongly, if the chief complaint from the parent is that it's sleep and airway and it's not ortho, you really should be working with an ENT before you take a case for ortho, before you jump into doing expansion, because we are not physicians, we are dentists, and our job is to straighten the teeth and fix bites. If we make an airway better, well, that's awesome, but that shouldn't be as much as we'd like it to be a major goal. Right now, the way that dental practice acts work and state dental boards is not that way. So you have to fix bites and straighten teeth, and anything else is just bonus that happens. All right, thanks.